Welcome to our channel. If you're confused about preventive and diagnostic care coverage, follow these step-by-step instructions to understand the important differences. Step 1. Learn that preventive care is designed to detect or prevent illness before symptoms appear. These services are typically covered at no cost under most insurance plans. Step 2. Understand that diagnostic care investigates specific symptoms or health concerns. These services usually require copays, coinsurance, or apply toward your deductible. Step 3. Know that annual wellness visits are preventive and usually free. These routine checkups include health assessments, screenings, and counseling when you have no specific complaints. Step 4. Realize the same test can be preventive or diagnostic depending on why it's ordered. A colonoscopy is preventive as routine screening, but diagnostic if investigating symptoms like bleeding. Step 5. Ask your doctor how services will be coded before your appointment. Request that routine screenings be billed as preventive care to avoid unexpected charges. Step 6. Understand that follow-up for abnormal preventive results becomes diagnostic care. If a free screening finds something wrong, additional testing and treatment will incur costs. Step 7. Know which preventive services are covered by your plan. Review your insurance policy or call customer service for a complete list of no-cost preventive care. Step 8. Verify with your insurance company if you're unsure whether a service is preventive or diagnostic. Getting confirmation before your appointment prevents billing surprises and disputes. Don't forget to like this video and subscribe to our channel.